All right, so we are going to start with the regular HRA, the health reimbursement arrangement. And so this is an account that has been set up by your employer to help offset a portion of your deductible expenses. The HRA allows the employer to make contributions and get that, give you a help there for the deductible costs. An HRA plan is an excellent way to help employees pay for medical expenses, and those funds are pre-tax funds. So there are a couple of medical plans. There's actually 3 different medical plans that you can enroll in. The HMO Blue New England Hospital plan is the first one that we're going to look at that's tied to an HRA. And so the deductible on the HMO Blue New England Hospital plan is a $1,000, $2,000 plan. If you're in a single, if you've enrolled as a single, you will be responsible for paying the first $500 out of pocket. Then the HRA will reimburse you for the last $500 of the medical deductible expenses incurred in the plan year. If you're in a family plan, the employee pays the first $500 of each family member's medical deductible expenses not to exceed $1,000 out of pocket. Then the HRA will reimburse you for the last $500 of each family member's medical deductible expense not to exceed $1,000 total reimbursement from the HRA. It is important for you to remember that an HRA is basically like an IOU, and where it's completely funded by your employer. If you get to the end of the year and there are some balances in your HRA, you don't have any claims to that money. It just stays with the employer to be used in the next year or so forth. So just make you aware of that if you do see a balance in your HRA, just remember it's completely funded by the employer. The money does stay with the employer. Now, if you're enrolled in this Blue New England hospital plan, there's also a copay HRA that you'll be enrolled in also. And the HRA will reimburse you for the last half of copays up to $2,250 for a single and up to $4,450 for a family plan. And those copays are covered under the HRA are emergency rooms, $150, ambulatory, $1,000, surgery copay, $1,000, inpatient hospital copay, $1,000, and then MRI, CAT or PET scans, $450. And again, remember the HRA is completely funded by the employer. So how does the HRA work? The HRA is administered by us at HRC. We are a partner with Blue Cross Blue Shield of Massachusetts. And what happens is Blue Cross and Blue Shield will send HRC all of the information that is needed to process the eligible claim. Now, if you're enrolled in this plan, the way that your claims are going to be handled are going to be a little bit different from the folks that are enrolled in the options plan. And we'll get into the differences here in just a bit. But just remember, right now, we're talking to the employees that are enrolled in the HMO Blue New England Hospital plan. So HRC will send a paper check directly to you after the claim is processed. And then you can log on to your HRC portal to see where claims are and see where things stand with the HRA. The way that this works is you go to your provider, go to your doctor. All you have to do is show them your Blue Cross ID card. The provider will bill the insurance carrier, and then Blue Cross will turn around and send those claims directly to HRC. HRC will process against the HRA, and if the HRA is due to pay out, we'll send that reimbursement to you. Some helpful tips about an HRA is you definitely want to keep track of your explanation of benefits. Blue Cross and Blue Shield will send you or at least provide an explanation of benefits on your Blue Cross site for any visits that you have. You want to keep an eye on those and just keep them in one place for your records so that you can just make sure that things are being processed correctly. If there's a discrepancy between your health insurance carrier claim summary and bill, you want to contact Blue Cross Member Services. If there's a discrepancy between the health insurance carrier claim summary and the amount paid, please contact HRC's customer service. If you receive a bill and no payment from the HRA is credited on the bill and the claim was eligible for reimbursement for the HRA, please contact HRC customer service. Now you might be thinking, how will I know if it's my responsibility or if the HRA is covering it? When you log into your HRC site, when you pull up the claims, if it says applied, that means it's your responsibility to pay. If it says paid, that means it was paid out of the HRA. So it's really easy to keep track of your HRA claims and payments and what is your responsibility and what is being paid by the HRA. Sometimes with an HRA, there does come a situation that is known as a reversed claim or an adjusted claim. A lot of times this happens because there was either an incorrect patient or provider information. Maybe the claim was coded wrong, mismatched medical codes, maybe even duplicate billing. If something like this happens, and again, it's rare, but if something like this does happen, the claim would be adjusted. You will receive an email letting you know that the claim was adjusted by Blue Cross, and then you will just contact the provider and just check on that claim. A lot of times what happens is they'll be paid out of the HRA, and then Blue Cross may go back in, realize that something was wrong with the claim, reprocess it, and then the provider ends up getting paid out of the insurance plan as well. So they've been overpaid. The provider will certainly see that, they'll know that, and then they can just return to you those HRA funds that are no longer available for that claim. And then you could send that back to us. We'll put it back in the HRA and have it available for you for future claims. Does anybody that's enrolled in the Blue Hospital Plan have any questions about this HRA?
Again, if you have any questions, feel free to unmute yourself or use the meeting chat. Otherwise, we'll continue on to the next plan. I think we're good, Larry.
Okay, perfect. So now we're going to get into the HRA that deals with the HMO Blue Options Plan, and this is going to be a little bit different than what we just went over. So again, HRA, same information. It's funded by your employer. It's to help offset the cost of your deductible. But if you're enrolled in the HMO Blue New England Options Plan, the deductible for that is $2,000, $4,000. If you're in a single plan, the employee pays the first $1,000 of medical deductible expenses, and then the HRA will reimburse you for the last $1,000 of medical deductible expenses. If you're enrolled in a family plan, the employee pays the first $1,000 of each family member's deductible expenses, not to exceed $2,000 out of pocket. The HRA will then reimburse you for the last $1,000 of each family member's medical deductible expenses, not to exceed $2,000. And again, as we mentioned before, the HRA is funded by the employer. Any balances would stay with the employer. This plan also has a copay. So if you're enrolled in the Blue New England Options Plan and you're part of that HRA, you're also going to be enrolled in the copay HRA. Similar to the one that we discussed with the Blue New England Hospital Plan, the HRA will reimburse you for the last half of copays up to $2,725 if you're enrolled as a single, and up to $5,450 if you're enrolled in the family plan. The copays covered under this HRA are emergency rooms, $250, surgical day, ambulatory surgical facilities, $1,500, inpatient hospital copay, $1,500, and then the MRI, CAT, PET scans, $450. Some helpful tips again for the HRA. You do want to keep track of your explanation of benefits. Just keeps you organized, and then making sure that everything's being processed and taken care of correctly. If there's a discrepancy, again, between your health insurance carrier claim summary and the bill, please contact Blue Cross's Members Services. If there's any other discrepancies between the bill, payments, and your HRA, please contact HRC's customer service. Now, this plan uses what is called, those are just the reverse claims again. This plan uses what's known as the true substantiation. And this is going to be a little bit different. This is where we're going to run into some different details that, and we want to share that with you today. So if you're enrolled in that Blue New England Options Plan, your claims are going to be handled through what's called true substantiation technology. And the way that that works is because of the options plan, the claims can't come over on a Blue Cross claims feed like what we talked about with the Blue New England hospital plan. It's because of the tiers, and there's just a lot more working components to the options plan. And so just a standard claims feed won't work. So we have this true substantiation technology so that your claims can be processed electronically and you can get payment as quickly as possible. Now, the way that the true substantiation technology works is you go in and create your login with your Blue Cross plan. There's also the ability through true substantiation to set up for dental and vision as well. But today we're speaking specifically about the Blue Cross plan. So you're going to have to log into the Blue Cross site, set up a account with them. You're going to set up a username, password, set up security questions and things like that. If you have a spouse or any adult dependents on your insurance plan, instruct them to create their own medical login as well with credentials, so you can register their credentials to allow HRC the ability to harvest the explanation of benefits to streamline your HRA, FSA, and HSA plans. If your insurance carrier has multi-factor authentication rules and gives you the option to elect security questions, use your mobile phone number or email address to verify your account, and then please elect the security questions. Now, this may seem like a lot of information being thrown at you at once. What this is doing is it's allowing you to set up your Blue Cross plan online, set up an online account with them so that you can log into Blue Cross and you can keep an eye on your explanation of benefits. You can keep an eye on your claims. You can see what's happening with your account. I know a lot of times in the past, you get your Blue Cross card, you go to your doctor, and there's not a lot that you really need to keep track of. Everything's being done electronically. Well, this is going to be done electronically too. However, you will need to have an account set up with Blue Cross with login information, a username, and so forth. Now, what's going to happen is you're going to be on the lookout for a registration email from HRC. And again, this is only for those employees that are enrolled in that HMO options plan. We are going to send out an email that is going to, hang on just a minute. You want to be on the lookout for that registration email from HRC, which will be sent to the email address we have on file for you, the subscriber. If you did not receive the registration email, please follow the custom URL created for the Advantage Truck Group to access the true substantiation registration process. Now, this is in here. This is general information. However, in that email, you will receive the custom URL to go in and set up and get the true substantiation set up. And then the screenshots in the next slides show you what your registration process will look like. This is another reason why this is being recorded, so that we can share it with you after the meeting, so that you can see these slides and know exactly what you're doing on each step of registering for the true substantiation. So you're going to get this registration email. This is what it's going to look like, and from HRC, and you're just going to follow the prompts and get registered. Registration, when the registration for the first time, consumers have to first enter their HRC online portal login information. Then once this is done, they will see this screen. Now, if you have not registered with HRC before, you do want to get that set up as well. So there's two things. You're going to set up an account with Blue Cross and be able to access the Blue Cross site, and you're going to have the access to the HRC employee portal as well. Whenever you get enrolled with HRC, you are sent an email welcoming you to HRC, and it does give you login information. Now, if you're like probably 90% of us, you get these emails and you get a ton of emails. Sometimes you dismiss them. Maybe you go to log into HRC and it says that your password is expired. That's easily corrected. We can reset that for you. The login process and setting up an online account with HRC is very simple. If you did not respond to the email and your password has expired, just contact our customer service department. They can reset that for you, and they could even be on the phone with you while you get that account set up to answer any questions that you might have. So once you have that set up, you're going to enter the credentials from your healthcare. Now, this demo slide shows United Healthcare, but it would be the Blue Cross site. So you're going to set up that information and give those things there. Once you are all done, you're going to get this message that says success. Your claims will now automatically be submitted to HRC Total Solutions shortly after they appear on the carrier website. So what's going to happen is once you have true substantiation set up, once you get this message of success, everything is set up, then again, all you have to do is go to your doctor, go to your provider, you show them your Blue Cross card. They will then in turn send the claim to Blue Cross, and then through true substantiation, we'll harvest or collect the explanation of benefits from Blue Cross to substantiate the claim. We'll process it against the HRA, and if it's time for payment to be sent out to you, we'll do that automatically. You can log into your HRC site. You know, you might get a check in the mail and be wondering what it's for. You can log into your HRC site and you can look up the claim, you can see the payment, and you can see what claim it is for. A lot of times, you will receive a check from HRC before you ever receive a bill from the provider. These electronic files, they happen very quickly. And so sometimes you'll get a check, but you haven't received the bill yet. You can just wait and use that check, or you can pay the provider quickly and then just reimburse yourself when the check arrives. Please note that once the credentials are entered via Easy Enrollment, it can take up to 72 hours for them to be validated. But once that's done, then all you do is just show your Blue Cross card at the provider, and then your claims will be sent electronically. So ongoing responsibilities: if your insurance carrier member portal credentials change mid-year, you will be required to re-register your updated credentials with HRC. So what that means is if in the middle of the year, Blue Cross wants you to update your password or change your login information or something like that, you do need to log back into HRC and update those things, because we won't be able to see those explanation of benefits if those things change. You will receive an email from HRC asking you to update your credentials, and you can use the Advantage Truck Group custom URL to re-register. If you add a spouse or adult family member to your plan mid-year, you will be responsible to gather their insurance carrier member portal credentials and register them with HRC. If you do not register for the true substantiation feature, you will be responsible for manually submitting your explanation of benefits in order to receive your HRA reimbursement, substantiate any FSA debit card transactions. So if you do not want to register with true substantiation, your claims can be processed through the HRA, but you will have to submit those manually to HRC so that we can process them against the HRA. If you are going to submit manually, you must submit all of your EOBs, all of your explanation of benefits, because if we don't get them all, we're not going to know when to apply HRA funds and send you a check, or what is going to be your responsibility. So if you are going to submit manually, please submit all of your explanation of benefits so that we can track your medical expenses accurately throughout the plan year. If you do register for the true substantiation feature, please do not manually submit a claim form or your EOBs for reimbursement, as we will receive them after your carrier processes your claim. So again, this is real easy. If you don't register for true substantiation, submit your explanation of benefits manually. If you do register for true substantiation, you do not have to submit anything manually. All right, this is the information for our customer service department. You can find this on our website as well. If you have any questions at all about your HRA, about true substantiation, about anything at all with these plans, please contact our customer service department. They're there Monday through Friday, 8:30 to 5 Eastern Standard Time. You can contact them by phone, you can fax them, and you can email them. There's also live chat that you can contact them and get some answers there. So please, if you have any questions at all during the registration process or anything, please contact our customer service team so that they can help you.
Larry,
All right.
I've got a question from the audience.
Sure.
I'm losing voice, apparently. So and I'm going to do a little bit of a background. So for members that were in the program as of November 1st, ATG, obviously this is a question for that group. Some of the people on the call who had formerly been part of the MTI program, obviously all of this for you will go into effect on January 1st. But the question is for the program, since it started on November 1st of this year, but we may not have registered, the HRA goes retro back to November 1st, but how is the processing working? Do we have to make up some process for the time between November 1st and today, since most people haven't registered?
Well, what's going to happen, and that is really a great question. What's going to happen is once you get registered and we can harvest those explanation of benefits, it will go back to November 1st. And because the HRAs pay the employee directly, you may have had to pay a claim out of pocket. But if it is HRA eligible, you will be receiving a check to reimburse you for those expenses. So yeah, great question. It will retro back to November 1st.
Great. And as a reminder, the only one you need to register for true substantiation is the options plan. The hospital choice plan automatically works, correct, Larry?
That is correct, yes. The hospital plan, the hospital choice plan, you do not have to register for true substantiation. That is going to come over on that Blue Cross claims feed automatically. The options plan is the only one that you need to register true substantiation for. Are there any other questions?
So hopefully this is, I know there's a lot of different, no pun intended, choices here or options here as far as which direction. For those of you that were part of the HRA before, we're trying to remove what had been a very manual process of you having to submit the claims to Rachel, and Rachel having to do it internally with our finance group and then getting the check. So while there may be a little bit more, what I would say, upfront work here, especially for the options plan to get that registration done, once that's done, this becomes a much more seamless process and you'll be getting your checks much quicker. Larry, you keep talking about a check. Is there an option to do an electronic deposit or electronic funds, or is it all going to be physical checks being mailed?
There is an option for direct deposit, and you can set that up on the HRC website. You would just go in on the website, you would hover over accounts, and then there's a place for banking information, and you can go ahead and put your direct deposit information in there, and then those HRA reimbursements can be directly deposited for you.
Very good. So even quicker into your bank, just saving another 3 days of time. I think that's all the questions that I've seen so far. Here we have. So there's a question about going back to prior years. What I would say for that person is, given I'm not sure which person it is because it's only the first name, just contact either myself or anyone on the HR team, or Rachel may be the best person to contact, and she can look to see if we've missed anything from you from prior years. Obviously that won't get picked up with HRC since we didn't have this program in place, but we can make sure if there's still anything left from 2022, I'm going to call it, the plan year that just ended on October 31st. And that's probably good general advice across the board. If after this call you have any questions, reach out to Scott, Relinda, Clara, Rachel, or myself, and we can get you the answers. Or obviously, if it's specific with getting logged in, probably that contact information that Larry provided from HRC is probably the best bet to go to get logged in. But if you have questions around how the plan all works, feel free to ask anyone in the HR team as well.
All right. Well, again, if there's no questions, we'll wrap this up. And Kevin, I'll get a copy of this recording over to you here in just a few minutes. And those that are enrolled in the options plan, just keep an eye out in your email for those registration emails. Go ahead and follow the prompts and follow the screen prompts, and we'll get you all set up and get this underway for you.
Thanks, Larry, and thanks everyone from HRC, and thanks everyone for joining today. Some great questions, and we'll see you soon. Thanks, Larry.
Thank you.